Hi, I'm Holly Fulton. I'm demonstrating CPR on an animal today. So if this were a real emergency, this pet would have been brought back immediately to where our surgery room where we have our crash cart set up. We would initially make sure, is there a heartbeat? If it was determined that there was no heartbeat, I would immediately start chest compressions. In a small animal like this, you can do it with the palm of your hand over the chest and use your whole entire hand, and you want to compress for a small animal about 120 to 130 beats per minute. If this were a larger animal, I would make sure that I had a good elevation where both palms would be over their chest, and I would compress. And you would want to do it to press the chest 30 to 50% each time, allowing it to come back to position. And as soon as somebody has started chest compressions, we would want to establish an airway. So we would want to intubate this patient with a proper size tube while on its side. Somebody else would be doing that. And I would continue chest compressions. And at that time, when we got the patient intubated, we would start oxygen flow. And we have IV catheter materials that somebody would try to access, preferably a cephalic veins. It has a quicker direction to the heart. We wouldn't want to use it in a rear extremity if at all possible. And we would get this patient stabilized. There would be somebody who is documenting everything that's being done and at what time. And the doctor would recommend which emergency drugs she would want to administer. And all of our doses are on the wall for very easy and quick viewing for all of our emergency drugs. And at which point we could start IV fluids and we would go from there.